So I prepared a few slides, just give a little background to the session and how the department supports the private sector. And then after that, I'll introduce my colleague, Dr. M Moodley from the Department of Health. And then he's all yours for the remainder of the session, where he can then give you information about COVID itself, the vaccines, approach to having pop-up sites, all sorts of things. So as I said before, I'm from the Department of Economic Development and Tourism. And there's a picture of me and Dr. Moodley. So on a daily basis, we actually get some information called the Vaccine Cascade. And I thought it would be quite interesting just to show you these statistics. And because it really does shed light on some of the discussion that's going to happen later. So as you'll see from this slide, of all the registrations for vaccination in the province at the moment, we've got just over 2 million. And including the actual trial that was done with healthcare workers, and nationally, we've administered 2.4 million vaccines to date. In terms of coverage of the over 18 population, it's about 36% of our population in the Western Cape that have been at least received one dosage. In terms of the second dosage, we have registrations for that, but as you know, a lot of people are still in that window period where they have to wait for their second vaccination. So that's just high level where we're at in terms of vaccinations. From a support perspective, as the Department of Economic Development and Tourism, acknowledging that it's not only about saving lives, it's about saving livelihoods, and really getting our economy back up and running and to the level it was before. We have been engaging directly with businesses, which includes yourselves in the tourism and hospitality sector. So we've been having engagements. We've actually been doing bespoke support for private sector sites, so sites that are wanting to establish vaccination sites. And then also comms and marketing around increasing vaccination uptake for our citizens. And this has been done in partnership with other departments, like the Department of the Premier, who are responsible for a lot of the messaging and the comms, the Department of Health, Business for South Africa, Westgrow, and then private sector bodies like your Tourism Association. In terms of the stuff we've really been doing, so around these engagements, we started with ministerial bilaterals with various sectors, and a couple of you on the call were actually in those bilaterals, which were hosted in about May this year. And those were priority sectors that were either vulnerable or opportunity sectors that had been hit by COVID, or because of COVID, there were opportunities where we could reach more people, or there could be vaccination sites, etc. With those bilaterals, we then furthered the engagement and had a Cabinet Meets Business, and about 90 companies were involved in that. And stemming from those two sets of engagements, 20 corporates stepped forward and said, listen, we want to establish sites. How do we do this? We had weekly Premier updates, which still carry on today, and you can easily log on to the website or look at Facebook and pick those up. They're generally on a Wednesday. And then there's been continuous updating of our website with information being distributed. We've also tried to leverage business supply chains. So, for instance, we approached PenBev to see if they would put information in the taverns and spaza shops in areas that we traditionally couldn't reach with our comms. And they generously have assisted with that. We've also encouraged registration drives, in particular on SATSA payout days, and this has been through the banks and retailers, and then mobilized the retail sector through CGCSA and the Council of Shopping Centres to establish vaccination sites, but also look at communications more broadly. In terms of the bespoke support, so we spoke about 20 corporates that actually said to us, listen, we want to set up vaccination sites. And a handful of them actually had the potential to serve a huge chunk of either their surrounding community or their workforce. So we partnered with the Department of Health and Business for South Africa to try and unlock the challenges. And to date, there are now 185 private vaccination sites in the province. And they're responsible for administering about 27% of the vaccinations to date. What's quite interesting is we almost, and Dr. Moodley can probably confirm, we almost have as many private sites as we do public sites. And when I say public sites, I mean Department of Health sites. So that is actually amazing from a business perspective that they've stepped up so much in that regard. Then just to show you, just in terms of accessibility, because we're starting to get a lot of inquiries, you know, the sites are there, but people can't access them because they're not open for extended working hours. So just FYI, I did a quick analysis of the listing that we've got, and the Discovery sites, Spa, Pick n Pay, and VitaCare seem to be the only ones at the moment that I'm aware of, and obviously every day this info changes, that are open either 6 days a week or extended hours, so kind of till 6 o'clock or 7 o'clock at night. There are another 100 sites in the province that are open during working hours, and I've listed them there. But what we're actually wanting to do is approach them in the next 2 weeks and say, hey guys, these are areas where we've got low vaccine uptake. Could you consider extending your hours at your sites? And I think this will go a long way to helping the Department of Health, whom themselves have opened up a couple of their sites over weekends, you know, and for extended hours, but this is at huge cost. So after that, yes, I just want to quickly show you what we've done around vaccine uptake. So really it's leveraging communication material, and I can follow up with this session with the link for all the public facing communication collateral that we've got. And then obviously this myth-busting session is one of those initiatives to try and help. We also have a vaccine ambassadors course, which I just want to put on your radar. There's a training session on the 4th of October, and that really enables individuals within an organization or within their community to be equipped with information and data-driven information, correct information, credible information that can be used to, you know, encourage people to get vaccinated and to help people around them to understand the importance thereof. We're also then looking, and you'll be aware of the work being done at health certificates and workplace policy. And this really is around enabling people to feel more safe and secure and have the assurance that the environment that they're in is going to be safe. And obviously from a tourism and hospitality perspective, that's really important for your sector. So on screen, and I'll send this to you, are a couple more contacts. My contact details are there. The resources on the coronavirus website, our vaccine dashboard is there, which shows all the sites and all the stats. Same with the private sector sites. There's a listing on Business for South Africa. And the reason I put this here is because a lot of you may ask, I want to get, you know, our guys vaccinated. What are our options? Go and have a squizzy at those sites first before you look at, you know, pop-up sites and things like that. Public sites also listed there, and then how to register. So at this stage, if there aren't any questions around anything I've just shared, I would like to hand over to Dr. Moodley. And I'm flashing everything on my dashboard here to you. Let's just get rid of that. Yeah, I'd like to hand over to Dr. Moodley, unless there are questions. If there are, just please pop your hand up or just shout.
While you're getting ready for questions, I'll introduce myself. So hello, everyone, and thank you for the opportunity to speak to you today. My name is Melvin Moodley. I'm a medical doctor working in the Western Cape Department of Health. My background, I've managed several hospitals in the Western Cape. I currently work as the Director of Health Intelligence, which is a unit that looks at and analyzes data on all the disease conditions in the Western Cape, but in particular, COVID-19 and our vaccination program. I teach in the University of Cape Town on various courses, and I'm happy to be here with you today. My opening, just in terms of how we like to do this, we want it to be interactive, so we encourage people to put their hands up and ask questions. But if you're feeling a little bit shy, that's fine as well. You can pop a question into the chat and we'll try and address all the questions. Now, the reason why I'm here today, I think the reality is, and it occurred to me one day when my brother phoned me, and he phoned me about, as he usually does, he wanted some medical advice for free. And it occurred to me that he just made the rounds. So he'd phone myself, he'd phone my cousin who's also a doctor, and then he'd phone his GP and try and get information. And it occurred to me that for many people, they're not as fortunate. They cannot access medical information that easily. And for a lot of us, there are some legitimate concerns. And in our current state, we have so much information flying at us. in this current state of information overload. If you don't have a family member who's a doctor, or you don't have a doctor readily available, it becomes difficult. So my purpose here today is to try to the best of my ability to answer your questions. I have one rule. If I don't know, I will say I don't know, and I will go look at the research and I'll come back to you. One more thing is I use something called the M&M methodology, or the M&M system. And it's quite simply, M is for my method, which is I only discuss scientific data. I base everything on the science, and I will tell you where I'm quoting from, when I'm quoting from the information, and what I will try and give you the absolute latest information that's available. The second part is my motive, why I'm here. I think I've explained it already, but I'm really here to help. I'm here to answer questions. I'm not here to scare people, and I'm really trying to give you the power to make the best possible decisions for yourself. I think what I've realized is that sometimes with the misinformation and disinformation that's out there, people have interesting reasons for doing what they do. My reason is very upfront. I'm here to give you information for you to utilize it to make the best possible decisions for yourself. And with that, that's the intro. Over to you. Does anyone have any questions? Put your hand up and go ahead and ask your questions. I see we've got Hanali. Hanali, you can unmute and go ahead and ask your questions. And for others, you're welcome to drop a question in the chat box as well. Go ahead, Hanali.
Thank you very much, Melvin. It has become a very emotional topic, I suppose, vaccinations and anti-vax, the vaxxers and the anti-vaxxers, and it feels like it's almost tougher than a religious conversation. So now we don't talk politics, sex, or religion, or vaccination in families and circles like that. What have you found to be okay, let me ask you the craziest reasons you've heard that people would not like to vaccinate, like the 3D, the chip, or the 5G chip, or those sort of things. What have those been, sort of the more outlandish ones?
Yeah, so that's an interesting question. Look, let's start by saying that the vast majority of people are not anti-vaxxers. And there's going to be a group of people, no matter what I say to them, I will not convince them. Sometimes there'll be a topic you can never find common space on, right? They have these deep beliefs, and I'm not, I don't want to say negative things about anyone. I want to be open to hearing it, but hearing what people have to say. But, unless you believe that there's a certain point where we can interact with people, where if we cannot find ourselves on the sun rises in the east and sets in the west, people landed on the moon, then it becomes difficult to have a conversation with the individuals. So I wouldn't say, so I'll tell you the things that I think people have concerns. These concerns originate somewhere. I'll tell you the concerns I'll cover three, right? Three. I don't think these are outlandish. I think these are concerns, and I often try to answer them. So the common one is, does this vaccine make me infertile? Does it stop me from being able to have children? It's very common. It's very common. And the answer is no. It does not make you infertile. It does not stop you from having children, whether you're male or you're female. We have tested it and it doesn't make you infertile, but also we have the mechanism, the way the vaccines work. It doesn't, it can cause side effects, but that's not the first side effect that occurs. It's not likely to cause that particular side effect. So we've researched it. It's not something. So categorically, the vaccine does not cause you to become infertile. So that's the first one. The other one is this one. I wouldn't say there's no silly concerns, but some people ask, they chase you with the vaccine? And the answer that I often give to people is, the answer that I will give to people is, you can't trace you. We can't use the vaccine to trace you. The vaccine is a very clear fluid. It's a very small amount of fluid. The amount of technology that they would have to put into something that's microscopic to trace you, there wouldn't really be a reason for it because we are all traceable through our cell phones. So there's much easier ways to trace people. The one that really concerns me is that the vaccine will kill you, right? That is one that really is concerned. Now, this originates somewhere and it gets people scared. And when people are scared, they become reluctant. Now, for a person who's not medically trained or doesn't have access to a healthcare professional, what are they going to do? One person is saying you're going to die from this vaccine, that people are trying to kill you, and the other person is saying, please take it. And to those people, I say the following. You know, I'm the person that's standing in front of you saying, I've taken the vaccine myself. My family has taken the vaccine. But if you really want to look at it, look at the people who've actually taken the vaccine. Donald Trump has taken the vaccine. All American presidents have taken the vaccine. Cyril Ramaphosa, the deputy president, has taken the vaccine. Most of the governors in the US, if not all the governors in the US, most of the Congress people, and soon most of the military, if not more than 98% of the military, and of course more than 99% of the medical professional doctors in the US have taken it. That's the first part. The second part is that ask yourself the logic, what would be the benefit of people like, you know, the government wanting to kill people? It doesn't make sense. And of course, the last thing is look at the data. SAPRA, which is the organization that looks into all side effects of vaccines in South Africa, they investigate every single death that could possibly be associated with the vaccine. Up to this point, have not found any deaths. Up to this point, have not found any deaths that is directly linked to the vaccine. So those are some of the concerns that people have. I've covered three. I've covered one that is quite common. I've covered one that doesn't make too much sense, but we have to answer because we have to be willing to hear people. And then I've given one that's very concerning. So I hope I've answered. I'm going to go to the chat and then we'll move to one of the questions, right? So here's a nice one, I'm from the President Hotel from Nikki. Are we able to set up a vaccine site at the hotel for staff? So Nikki, we are very keen on making it easy for people to be vaccinated. The truth is there's a group of people. So there's a group of people, I remember when the vaccination started, who just raced off to get a vaccination, and they were very eager, the early adopters, as Lisa often says. But we also agree that there are some people, we just want to make it as convenient as possible to get a vaccine. If you are interested in what we call an outreach site at your facility, I think engage with Lisa, because Lisa's been working with my colleagues in the Department of Health to set up these outreach sites. There's a little bit of discussion and logistics, but if you're interested, our interest is making it easy for you, and I'm sure we can set something up. Okay. Then, and anyone wants to put their hand up, please put your hand up. I like to get questions from the audience and the group. I've got one from Anja. Anja, go, and then I'm going to go to Carolina's question in the group. Anja, go ahead and ask your question.
Yes, hi, thank you. So I've just got a question. I'm not vaccinated yet, and I'm very skeptical. I have heard a lot of pros and cons. One of the things that I find that's holding me back is that it's been such a short trial for this vaccination to be tested. If you look at, for example, AIDS, I mean, AIDS has been around forever and there's never been a vaccine found. How come they can find a vaccine so quickly for COVID, and has it been trialed and tested properly? That's the first thing I would like to say. The second thing is we've got a neighbor who's passed away from the vaccine. I know this is, like you say, it's not proven or anything, but it seemed very likely that was his cause of death. So I'm very hesitant. And yeah, with the side effects, my husband has been vaccinated and he has suffered quite badly. So that's where I am at the moment.
Yeah. No, thank you for your question. And as you said, you raised concerns, right? So let's try and answer it, and I'll take you to the science of each of these. Now, the first question you ask is, and we get this question all the time. Lots of people ask, how did this vaccine get developed so quickly? So remember, there's lots of different types of vaccines, but we'll address the two in South Africa. These are also the two that are utilized in the US. The first is the Johnson & Johnson vaccine. Now, the Johnson & Johnson vaccine, I'm going to use a little bit of scientific terms, uses an adenovirus vector technology. This sort of vaccine has existed for a very long time. They were testing it in Ebola. They've used it in other disease conditions as well, right? So the Johnson & Johnson is based on existing technology. We've used it for a long time and we know how to use it. So that's the first one, right? And we're talking multiple decades. The Pfizer vaccine is an interesting one, and I encourage you, Anya, to go and look at the history of the Pfizer, history of the mRNA vaccines. And there's a wonderful story about a scientist who was trying to develop it and just couldn't get going. So the Pfizer vaccine is based on an mRNA vaccine. It's actually been in development since 1990. And they've been looking at it for various disease conditions, including Zika and influenza. So they've been looking at it and even for various sorts of cancer therapy. So it's been around since 1990. This is the new one, right? The problem with the mRNA vaccine is that they just couldn't get it to enter the cells. It was being broken up too quickly. And they finally figured out how to do it recently, probably in the last few years, right? I don't know exactly when they figured that out. And they also realized that you had to store it in hyper cold temperatures. So the Pfizer vaccine and the BioNTech vaccines can't be stored long-term in normal fridges. So I'm just giving you a little bit of the history on that. So the first part is they've actually been around for a long time. The second part is, okay, then how did we develop it for COVID-19? So COVID-19 was first diagnosed on the 31st of December 2019. We didn't know it was COVID-19 then, but we traced it back. That was the first report. That's why it's called COVID-19. And so in January, China released the genetic sequencing of the COVID-19 virus, the SARS-CoV-2 we call it. And scientists around the world immediately took it and restarted their own vaccine production systems for a vaccine towards COVID-19. And that's where the starting point is. Once you had the genetic sequencing, you could then work on it for your mRNA vaccine and your viral vector vaccine. This is the Johnson & Johnson vaccine. And similarly for the other types of vaccines like the Sinopharm vaccine, etc. Now, the third reason is a little bit more cynical, but it's the reality of the world we live in. As soon as the extent of the vaccine the COVID-19 problem became obvious, billions were poured into the vaccine development. But government subsidized it, like the US with Operation Warp Speed. They subsidized it, but the organizations like Pfizer, BioNTech, and Mrna realized that if they could get to a vaccine quickly, they could potentially make a lot of money. And that was the incentive. The last thing is that the teams that were doing this work were already in place. So all of that put together, that's what happened, and that's why the vaccines were developed that quickly. The reality, Anya, sadly, is that we should be developing vaccines for all conditions as quickly as this. In this instance, people were really incentivized. So that's the first part. And look, I'm not sure, it's not a hard sell, I'm giving you the history of it. I urge you to look at, I'm trying to think of what is a good site for you to go at, but look into, go into the CDC. They've got an excellent website where they cover a lot of the information that I've given you. So the second thing you asked was about your neighbor, and we get this, right? So sometimes people have a vaccine and they may pass away shortly after the vaccine. Now, the question you have to ask from a health perspective is, did this person pass away because of, Okay, I'll answer the question about HIV after this. Did this person pass away from the vaccine, or did they pass away from something else? And that's the tricky part. So every time a person is vaccinated and they pass away, that death has to be investigated. And it's investigated by an organization called SAPRA, which is the South African Health Products Regulation Authority, and they cover all medication in South Africa, and they investigate all deaths. Now, I've downloaded the latest report, but they will be publishing a new report. But I will cover, and I'm going to give it to you in detail, right? I'm going to give it to you in detail in terms of SAPRA. If I can just find my note. Yeah. So this is my note, and I made a note of this because we do get asked this question. So on the 25th of August, SAPRA was investigating 53 deaths. 53 deaths. Now, it doesn't mean 53 deaths occurred because of COVID-19. It means that after the vaccination or around the period of the vaccination, 53 deaths have occurred. Of them, 32 cases they investigated fully, and they felt that it was 32 they investigated fully, 28 were classified, and in 22 of the cases, the patient died incidentally of not a COVID-related illness. For 6, the person died of COVID-19, which means they may have been infected in the period. I'm looking at the data, and for 4, it was unclassified. And what I mean by unclassified is when SAPRA went to the family, they said, we'd like to investigate, and the family said, no, we're fine with the way things are. This is a sad moment in our lives. We don't want to pursue this. And so 4 are unclassified. And at the time, there were 21 cases still under investigation. Now, Anya, I give you that level of detail to let you know that these things are investigated. The vaccines are probably one of the most intensively monitored medications in existence. And at this point in time, I know that there's even more cases. I think the number has gone up, but SAPRA still has to release an official documentation. But at this point in time, we haven't been able to show in South Africa, or there are no deaths in South Africa directly caused by the vaccine. And that's the information available. If we look at the Johnson & Johnson vaccine, there have been 2 cases of the most severe side effect, what we call the TTP, and no deaths associated with the Johnson, I should say with the Sisonke trial, which is over 300,000 participants. There are no deaths associated with the Johnson & Johnson vaccine. So that's the information. Now, again, I'm giving you the information and I ask you to think about it. Remember, if someone gets a vaccine, and it's terribly sad to say this, but if they get a heart attack or they die of cancer immediately after the vaccine, it doesn't necessarily mean it's caused by the vaccine. But I do agree that for public confidence, it's important that we have organizations that SAPRA that follow this information. I'm going to answer your question about HIV, and I know you asked about safety, and we'll talk about that. I'm going to answer a few more questions. It will come up in the discussion. The last thing I'll say is about why haven't we found a vaccine for the HIV? I think the HIV is a different vaccine virus. It's harder to deal with than the COVID-19 vaccine, which has a spike on it that's easy to identify and kill. And we've tried desperately for years to find it, and we are having promising signs, and we're hopefully moving towards an HIV vaccine. But the difference between HIV and COVID-19 is that one is fortunately, COVID-19 is easier to create a vaccine for than HIV. It's as simple as that. It's got to do the HIV virus is much easier to has the ability to hide much easier than COVID-19. Anya, I hope I've given you something to think about, but please feel free to go to the CDC and other websites and to express your discomfort with certain things. And hopefully in some of the other answers, I may answer some of your questions, but please go and check all the various websites to verify the things I've said.
Thank you. Yeah, that's been very informative. Thanks very much.
Sure. And you're allowed to feel uncomfortable, because I think people get a lot of information at them. So,
yeah.
Okay. Here's a nice question. Has the jab not been oversold? Was initially made out that it would prevent infection, then became that it would still allow infection but minimize chances of hospitalization and prevent transmission to others? And okay, I get the question. Is this the case? Surely the vaccine is about the protecting the individual. If that is the case. Okay, sorry, I'm going to read this question. It's a nice question, but it's a bit long. Has the jab not been oversold?
Melvin?
Yes.
Sorry, Barry is not shy at all, so I think you should ask the question. Come on, Barry.
Up to you, Barry.
Okay, let me unmute myself. Can you hear me?
Go for it, Barry.
Okay, I'm gonna try. Rereading it, I can see that it was a flow. It was a flow of thoughts. Yeah. So basically, the question is, because there's been a lot of about, and you see it on every Facebook profile in terms of I'm jabbed. Thank you. So you can thank me later or what have you. Increasingly, and we've seen this in the UK and other countries, there's evidence that the vaccine does protect the individual, in particular if they're in an at-risk category. So there's no doubting that whatsoever, and that's not being disputed. But there's also a lot of evidence that you can be infected and you can transmit it. And in fact, the transmission rate is a lot higher than was originally anticipated. So on that grounds, a lot has been made out about, okay, we're now dealing with a pandemic of the unvaccinated, etc. But there's evidence that if you're vaccinated, you're also able to transmit. So it goes back to my other question, which wasn't read out, about the risk profiles by age category without comorbidities, and the real risk of hospitalization by age category. Because obviously we're all aware that individuals over 60 are very much at risk, and in particular if you have conditions such as diabetes or high blood pressure or anything like that. At what point do we say we've covered the at-risk categories, and therefore, even if you had the vaccine and it can still be transmitted, we've covered. I haven't even gone over my actual question, but the vaccine, the way it started out and the way it's become now, has evolved, and surely we need to be evolving the approach being taken as well with that in mind. I hope I'm making sense.
Well, Barry, so that question is at a level of depth. I listened to a podcast. So these two professors from the New England Journal of Medicine were having that discussion, similar to what you were bringing up, similar issues to what you brought up. I'll do my best, and I'll give you what I understand about it. So there's a couple things. So the first thing I try to use as the best example of how things change, right? So when we give advice in medicine, it's based on the best information that we have at a particular point in time. And we get better at understanding things over time. This was a particularly problematic virus because when we started getting cases in March last year, and when the rest of the world started, it started slowly and then rapidly went up. We really didn't know what was going on. So we tried to do the best we could with what was the available information. And we are slowly getting more information. But interestingly, new things are happening, like the new variants. So I always like to think of it, my new example is Manchester United. And I'm not indicating whether I'm a supporter or not. But in the beginning of the season, Manchester United had when you look at the team, you say, okay, what are their chances of winning the league? Well, maybe good, right? And no one knew that 3 months later, they would acquire Cristiano Ronaldo, one of the world's best footballers. And so suddenly the assessments and analysis and projections change for Man United. Now they become a significant title contender. It's the same that has happened with COVID-19. And you're absolutely spot on. Initially, when we developed the vaccines, and we had Pfizer was 94% against infection, symptomatic infection, 94% infection. And at that point in time, we thought, well, we have achieved, I mean, this is amazing. And we were very hopeful. And I think what happened is the beta variant just came in and made us realize that we were in trouble. So the vaccine mutated. And then after beta, there was gamma. Gamma was mostly in South America, so it didn't make a big difference. And then there was delta. And delta was a different game altogether. And when we look at it in healthcare, we look at wave 1, which was okay, that was wild type. Wave 2, which was quite bad, which is beta, which is December, January last year. And then delta, which is just coming, we are on the downward track and trying to finish. So we'd say July, August, and September this year. Delta is multiple times more transmissible than the original COVID-19 variant, what we call the wild type. Delta has immune escape. It can escape the vaccine. Delta, they've looked at it. They feel there's suggestions that it is much more transmissible than flu and as transmissible as measles. So I've given you the story now, right? So what changed? Well, the mutations, right? And as a consequence of the mutations, the vaccines are less effective. Are they not effective? The answer is no. They are actually still very effective. So let's talk about what does work, right? Because the sad thing is that the vaccines are less effective, but what does it mean? So right now, the vaccines offer you protection against symptomatic illness, right? But it doesn't offer you full protection. So the Pfizer 2 doses offers you up to 88% protection against symptomatic illness, right? And that's not, we're still investigating exactly how long that is, but it offers you 88% protection. But it still means that you can get infected if you have the Pfizer vaccine. It's what we call a breakthrough infection. Where the vaccines are exceptional is protecting against severe illness and death. And the Pfizer vaccine is over 95% protection against severe illness and death. And the Johnson & Johnson vaccine in South Africa is 91 to 96% protective against death. So these vaccines, the idea about protection against symptomatic infection has moved to what really protects you against is severe infection and death. And that's what we really want. We want to be protected. If you're 40, 50, 60, 70, 80, you don't want to die from this thing. You want to be protected against that. No one minds a sniffle. No one minds a cough for a couple of days, but everyone minds being ventilated. We come back to the conversation between these two specialists. And I think what they say is this: we've learned a lot in the last almost 2 years, and we are moving away from the idea of completely eliminating symptomatic disease. What we are rather saying is, let's try and make COVID-19 less severe than the flu. That's the big one. We live with the flu all the time. Wouldn't it be amazing if we could make COVID-19 less severe than the flu? And there was an actuary, I think he's Discovery's chief actuary, and he mentioned the stats in the UK. And what he said was the vaccines, before the vaccines, and this is their observational data, before the vaccines, dying from COVID-19, your chances of dying from COVID-19 was 10 times higher than dying from the flu. After the vaccination process and the time period, your chances of dying from COVID-19 are half that from dying from the flu. And that was what we're moving towards. We're moving towards this idea that let's make it less severe than the flu. We can't protect ourselves completely from infection, but we can protect ourselves from severe illness and death. One more thing, the recent studies, and Barry, I know you sound like you've been reading up on the stuff because I'm really having to dig deep into the data here, but there's been a very clever study from Scotland that shows that it's highly likely that the vaccines protect against transmission, and there's decreased transmission, and they've worked that out. So it does protect against transmission. Just some recent data on this. The final thing I'd say, and I've given you a very long answer, but it was an amazing question, is you are absolutely right. You've also got to think of the vaccine as protective for myself. So when I take the vaccine, and the time, 28 days has passed, 14 days from the Pfizer, 28 days from the Johnson & Johnson, I know that I'm decreasing my chance of dying from COVID-19, and that's what I want. So it's also about personal protection. But as I said, if you get enough people protected, you can turn it into something less severe than the flu. But Barry, really an excellent question, and it points to the history of what we've gone through with COVID-19. Thank you for your question. I'm going to look now.
Dr. Moodley or Melvin from Melville?
Yes, yes.
Not from Melville or Melbourne. I liked the question at the Miriam Kiro at the top. So it might be easier if I just throw some of the questions because I've read them and you're busy answering. So, but she was asking, you know, a lot of people are talking about developing your own antibodies by contracting the virus. Now, what is that story about?
You know what? I really love the questions from this group. Now, I must be careful not to take too long to answer, right? And because you can see that none of these things are simple, right? So let's go through it. So when you get infected by COVID-19, you develop antibodies. It's your body's way of fighting off the COVID-19, and in fact, your body creates its own system to against. If you get exposed to COVID-19 again, your body has its antibodies. So think of antibodies as the fighters in your system. So the question is, if you get infected by COVID-19, don't you have your own antibodies? It's sometimes referred to as natural immunity. Excellent question. Now, by the way, what vaccines are doing, it's actually trying to mimic natural immunity. So when we give you the vaccine, and I'm not going to go into the detail, but if you read up on some of the vaccine, so what the vaccine does, let me explain. The vaccine goes into your body and it teaches your body to make antibodies to COVID-19. It's actually the spike protein in COVID-19. By the way, the vaccines that we use in South Africa do not contain the virus. That's an important one. People often ask that. So getting infected causes you to create antibodies. Getting a vaccine causes you to create antibodies. And some people say, well, why can't I just rely on natural immunity? There is an answer to that. So the first thing is, if you are infected with COVID-19, you do develop some degree of immunity. Now, it depends on what variant you were infected by. So if you were infected by, and I can give you when the variants occurred. So if you were infected in April last year, you would have been infected with original or wild type COVID. If you were infected in December 2020, you would have been infected with beta, most likely. If you are infected in, let's say, July 2021, you are most likely infected with Delta. More than 90% of the cases were that. So if you developed your antibodies depending on when you developed your antibodies, you become more at risk. So if you were infected in, let's say, March last year, you developed antibodies, good, you've got some antibodies, but we've just described that Delta can escape some of the vaccines, and Delta can also escape natural immunity. And that's the important thing to understand. And so I wish more than anything that we could rely on natural immunity because, and I'm going to give you a stat now, there are estimates, discovery estimates between around 80%. Let's say there are estimates between 60 and 80% of South Africa has been infected, right? And so just look around your room. If there's 3 people there, that mean whether they know it or not, they've been infected, right? So that's the reality. I wish we could rely on natural immunity. But what we are seeing is that the mutations, just as I answered the question from Barry, the mutations allow the COVID-19 virus to escape natural immunity. And that's the problem. So we know that you can have natural immunity and you can have vaccines. So which one is better? That's an interesting one. And I'm going to say something. Together they are even better, but let's talk about it. So there's been a study in Kentucky that shows that if you just have your infection or you have a vaccine, just the 2 of them, and this is an mRNA vaccine, the vaccine gives you better immune response. I'm just going to say that immune response. It's a very technical thing, but I'm not going to say absolutely, but it gives you a better immune response. Interestingly, if you have infection and you take your vaccine, you get what we call hybrid immunity. So you get an even better immune response. You get like a supercharged immune response. And one of my family members got infected and then asked me what to do. And I said, please go and get yourself vaccinated. Donald Trump, if you guys remember, he got infected at some point in late 2020. And then according to media reports, he was vaccinated in 2021. So being infected does not mean you shouldn't get vaccinated. In fact, if you get vaccinated after being infected, you have even better immunity. The last thing I'll say about natural immunity, and again, I wish beyond anything that national immunity would have been enough, but unfortunately, it's not enough because of the new variants. For the people that are relying on natural immunity, it's a risky game. It's a risky game because while we know that it's mostly the elderly and mostly the immunocompromised, I know people who are in their 40s that have died. I know people in their 50s who have died, and there have been cases of younger people that have died. So it's a risky. It's risky to put yourself in that situation and expose yourself in that way. Just rather safer for your own safety to take the vaccine. Right. Next question.
Thank you so much, Melvin. That was a really good one. I've got one from Benita around graphite oxide supposedly being the poison in the vaccine causing heart issues.
Yeah. So what I'll do is I'm going to share my screen just for a second because people ask what's in the vaccine, right? And so I'm going to just show you quickly. And there we go. I'm going to just make that a bit bigger. And so these are the, and I'll give you a little bit of information. So these are the two vaccines, three, Pfizer, Moderna, and Janssen, and I'll send it to the group so that they can look at it themselves. This is from the CDC. And there isn't, I don't see that substance. Now, I don't know, I'm not a biochemist or a pharmacologist, so I can only read these ingredients, but I don't see that particular substance. And they also put a disclaimer here that it doesn't contain eggs, gelatin, latex, or preservatives, and it's free from metals. So this is available to you, and you can check on it. Now, of course, this is from the CDC. This is from the drug manufacturers as well. And just so you know, we've given in excess of 5 billion. I think we in excess of 5 billion vaccines all over the world. The side effect profile of vaccines, and I'll get to it in more detail, it's incredibly low. I do not see that substance. I don't know if you can see the substance in there, but that's everything that's in the vaccine, and you can have a look at it. That's from the CDC and from the drug manufacturers as well. So please have a look at that. I don't see graphene oxide in that.
Yeah, thank you. And Benita is saying here that the question relates to doctors saying that it is included. So I'm not sure if you've got an answer to that. Maybe that's something we can have a look at and we can come back to Benita on.
Yeah.
Or so Benita, if you want to, sorry, Melvin, Benita, if you want to unmute yourself and just maybe explain what the question was around. Otherwise, we can go back to Melvin.
Hi, good day. Thank you so much. Yes, now it's I also have family and friends and doctors on the natural side and doctors on the actual, medication side or chemical, as they would like to call it. So yes, it was just a particular thing that doctors had a discussion on. And I know that there was some research by some Spanish doctor. And basically, at the end of the day, the doctors are saying that this is the ingredient that causes blood to become thicker. And that's why people get heart disease. So sorry if I put you on the spot, doctor.
No, so look, there's the ingredients. No. Absolutely. So Benita, I have no issues. So there's the ingredients. I'll make it available to you. I can't see any graphene oxide. But what I'm going to do is I'm going to talk about side effects now. So we'll move into side effects because Anya also asked about side effects. But as I can see, I can't see graphene oxide there. I'm happy to research it for you, but these are the ingredients in there. But let's talk about it. Let's talk about side effects. and let's talk about the safety profile of vaccines. As I said, and I'm going to quickly check a statistic, but we have given more than 5.5 billion vaccine doses, right? And there's different types of vaccines, but I'll talk about the safety profile of the Pfizer and the Johnson & Johnson, because these are the two vaccines that we are giving in South Africa. Again, I'm going to start by saying SAPRA investigates every adverse incident, and they haven't associated any deaths with the vaccine directly up to this point, right? That's a South African context. Now, if we look at the US, they did a study on Johnson & Johnson, 7.9 million people, right? Now, the clotting disorder, the most severe clotting disorder, which is TTP, I'm just going to double check, but they found that it occurred in 4 to 6 cases per million people. Now, to put that in context, it's an incredibly low number. I'm not going to come here and say that there's absolutely no side effects, but I want you to look at it in the context of 4 to 6 per million, right? In fact, with the Johnson & Johnson vaccine, they found that of the people that had side effects, 97% of them had very mild side effects. 3% did have serious side effects for which there is treatment. And as I said, the most severe side effect is what we call the TTP, which is the clotting disorder. It's interesting because Discovery in South Africa, and Adrian Gore was quoted, and he said that from their investigations in South Africa, less than 1 in 20 had any side effects within 7 days, and almost all recovered quickly. So I do want to say that while the side effect profile in the vaccines, it's one of the safest medications we've given. We've really been, and we are researching it all the time. If you consider cancer treatment, some of the hypertension treatment, your cholesterol treatment, they have a more severe side effect profile than the vaccine. We stress that there's nothing that's perfect, but it's got a very good side effect profile. And I think that's what I want to say. With the Pfizer vaccine, Israel has probably one of the best medical record system, and they took two groups, 800,000, and they found that the side effect profile was very good. So there were 4 things that people were getting: lymph nodes, swollen lymph nodes, something called herpes shingles, and appendicitis, and the most severe one, which is myocarditis, which is a little bit of an inflammation around the heart. That's the most serious one. In the Israeli study, they found that it was about 1 to 5, about average was about 2.25 per 100,000 cases. And of course, these are all treatable, right? They found that in the UK, the numbers were much higher. They were about like 6 cases per million. So actually, I should say the numbers were much lower. But be that as it may, the most severe side effect occurred in a very small amount of people. And here's the interesting one, Benita. They then looked at the group that didn't get vaccinated, and they found that COVID-19 caused the same side effects to a much greater extent. You would get myocarditis far more often from COVID-19 than from the vaccine. You would get arrhythmias, heart attacks, all those various things much more often than from COVID-19. I'm happy to look at the graphene question you covered, but as I said, it is not listed in the list of ingredients provided from the CDC. But I think the message I want to give is that our research shows that the vaccines are one of the safest things that you can take. There are side effects, and for the most serious side effects, we do have treatment, but by and large, it's a very safe medication. Most of us, and I don't want to dismiss those people that do have side effects. Some people can have side effects, and we've heard on the call already. I want to look at it, though, from a statistical perspective, and that sometimes sounds a bit cold, but by and large, the vast majority of people do not have serious side effects. Just so that you know, my personal experience, and this is what if you do have a side effect, it's usually mild. It's a bit of arm pain about an hour or 2 after the vaccination. Some people feel tired the next day. Some people have a little bit of a headache and some body aches. In my immediate circle, and now this is not statistical, this is my personal experience, My wife had a slightly sore arm, more sore than mine. She felt my brothers didn't have anything significant. One of my colleagues felt very tired about 12 hours after receiving the vaccine, but those symptoms settled after a day. So there's various experiences, but I think I want to settle down with its safety profile is very good. Again, please go to the New England Journal of Medicine, go to the CDC, go to SAPRA, look at the side effect profiles, but I can tell you that all our research shows that it's incredibly safe. The TTP is an immunological response. I'm not, according to the research I've read, there isn't a specific, they don't understand fully why it generates that immunological response. But I'll have a look at that in a little bit more detail for you on the aside. Hanali, I can take one more question. I don't want to keep people too long. Yeah. And then I'm going to quickly go through some myths, and then I'm going to end off with some information about protection from the vaccine, if that's okay.
Sure. Is there any particular group? Well, look, the whole issue around autism. So people who have maybe autism in their family, it sort of relates back to this question. Is there a specific group that should maybe not vaccinate or think about more carefully about vaccination?
Yeah. So no, if you're autistic, it's not a contraindication to being vaccinated. So that's an absolute. Is there a specific group? Yes. If you are allergic to one of the ingredients in the vaccine, then you should, and if you've had what is referred to as, let's just make it easy. If you're allergic to one of the ingredients in the vaccine, you need to be cautious and you need to speak to your doctor before you get vaccinated. So for example, if you are allergic to one of the ingredients in Pfizer, then your doctor says, okay, then go and get the Johnson & Johnson. Remember, if you're a 60-year-old with diabetes and hypertension, you are under a lot of risk. The Delta variant does spread very quickly. And so we have to make sure we keep you as safe as possible. So then you have the possibility of looking at the other vaccine. If you've had an allergic reaction to any vaccine or injectable, in South Africa, our policy is we will consult with an expert before we give you the vaccine. So in each case, the rules are slightly different, and so we consult where we need to. The third thing I would say is, if you have a complicated medical condition, if you have, let's think of Takayasu syndrome, right? And I'm not saying that you need to go out and read up about Takayasu syndrome, right? But, or giant cell arteritis, and I'm throwing these words around because they are complicated medical conditions. I always advise everyone I speak to always have a chat to your doctor. Your doctor understands your medical circumstances better than anyone else, certainly better than I do, and get their advice. But if you have no serious medical conditions, there's no contraindications or major contraindications to taking the vaccine. And certainly someone who's autistic, absolutely no contraindication to taking it. One of the things people ask is if you have blood thinners, can you take it? The answer is yes, you can. The rule is you need to be in what we call a therapeutic dose, which is a special range for your blood thinners. But again, your doctor will tell you whether you can or you can't. You can have a conversation with them. Very importantly, if you're pregnant, you should take the vaccine. The American College of Gynecologists and Obstetricians and Gynecologists have come out, and so has the CDC, and so has multiple organizations in South Africa, and said, please take the vaccine if you're pregnant. And it doesn't depend on which stage of pregnancy you're in. What they found, or what we have found, is that the vaccination does not increase your risk of a miscarriage. It does not harm the baby. But COVID-19 does increase your risk of miscarriage and does increase the mother's risk. So the mother can be at risk. And I think that's what we're concerned about. And that's why it's very sad when we lose mothers and their babies are born and they've died due to COVID-19. So we strongly recommend that pregnant women and breastfeeding women get vaccinated. I'm going to hold it. And
can I ask you one last thing before you do your roundup? Barry and a few of the other people have done some really good questions here. We haven't addressed maybe all of them, but is it possible to send you these or to Lisa, and then we can get, you know, maybe a little bit of it, and even if you record it and send it to us, that would be perfect. But other than that, thank you so much. You're welcome to wrap up. It's been amazing.
It's my pleasure. I love the questions. Barry seems to ask the most interesting questions. He's asking about now herd immunity. And I'm going to give you a more detailed and thought out answer, Barry, because and the question you asked about different risks in different age groups, I mean, that's just bottom line, different risks in different age groups. The older you are, the more at risk you are. If you have comorbidities, you are at greater risk. So anything, diabetes, hypertension, HIV, they all put you at greater risks. And anyone with a depleted immune system, if you've got, for example, if you had a transplant and you're taking immunosuppressants, you are at greater risk. But I'll give you a more detailed answer. The question of herd immunity, again, the same two, Barry, you should have joined them in the conversation. That the professors from the New England Journal of Medicine said, because of the variants, I think we're moving away from that goal of herd immunity, because it's starting to, we thought initially it would be 70%. And we'd reach herd immunity. Now it seems you'd need to be even higher. I think what we are aiming for is to make COVID-19 less severe than the flu. People do die from the flu every year. What we say, and we live normal lives. I think we all, what we want to do is through vaccination and getting people vaccinated, we want to make COVID-19 less severe than the flu. And I'll answer your other questions in a little bit more detail. I'm trying to think if there are any particular ones that are, people often ask, if I get the vaccine, will I test positive for COVID-19? The answer is the two vaccines that we have in South Africa, categorically no. I've researched it very carefully. My brother asked me that question and I told him, no, it does not contain the virus, and it does not contain particles of the virus. Two more questions. Does it affect my DNA? I think it didn't come up here, but it does not affect your DNA. It stays far away from your DNA. It doesn't affect your DNA. And it's eliminated from your body very quickly. So the mRNA gets eliminated very quickly, and the Johnson & Johnson gets eliminated quickly as well. So I'm going to show you some slides as I wrap up. And I'm going to show you some of the data. And Barry, you said something about the disease of the unvaccinated. And one of the saddest things, I think all of us have been hurt by this horrible virus. In South Africa, we think, if we look at data from the MRC, that 250,000 people plus have died from COVID-19. And I certainly know people that have died from COVID-19 and it was not their time to go, but the virus took them from us. If we look at a graphic, this is a very popular graphic in terms of people hospitalized in Groote Schuur Hospital on the 6th of September. You can see the people that are unvaccinated versus the people that are vaccinated. And if you look at the high care ICU and the people on ventilators, the people that are there are actually the unvaccinated. And my colleagues, the medical doctors working in ICUs, the specialists, they say that the people they are seeing are the unvaccinated. These are the people that are filling up our high ICUs and our high cares. We did our own work in this, and we looked at the risk of death in healthcare workers that were vaccinated versus those healthcare workers that were unvaccinated. And what we found is that the risk of death is 3.3 times higher in unvaccinated versus vaccinated healthcare workers. Okay. And then in a recent study, this came out very recently, I think it was a week and a half ago. In the United States, they looked at 13 jurisdictions, and they looked at people who were fully vaccinated versus people who were not fully vaccinated. And your chances of hospitalization were 11 times if you were higher, if you were not fully vaccinated, and your chances of death were 10 times higher. So your risks, if you're not vaccinated, are so much higher. These are some other data that we have. And this is the DNA, and this is the recommendation that we've on pregnant people. I'm just going to move this. I think the bottom line is, I think every question is valid. And we don't treat these questions with disdain. We treat it with, let us try to understand each other. So for someone who's afraid, who's had negative personal experiences, what I say to you is, let me try and answer this best I can and put the information in your hands so you make wise decisions. I think at the end of the day, I want what everyone else wants. I want to spend Christmas with my family. I want us to be able to go back to life the way it used to be. The front page of the Business Day talks about us still being on the red list, and the damage to our economy has been heartbreaking. We need to look at what will protect us, protect our families, and protect our loved ones. I hope I've been able to give you the information that you can use to make the best possible decisions for yourself. And again, thank you for the opportunity. I will answer the questions when I get at a later stage, but please send it to me. Thank you very much.
So thanks everyone. I've just shared those contact details on screen again. So and what I'll do is I'll pop them into the chat box as well once we end the session. But I'd like to say thanks once again for making the time to join us. I do know that some of you got a late notification, but you managed to clear the diaries and attend. And from a SATSA perspective, we'd like to obviously follow up with you guys around the pop-up sites and how that can be dealt with as a sector. So we can engage on that in days to come. But thanks again all for your participation, and thanks, Dr. Moodley. I always learn something new every single time we have a session, and wishing you all a great start to the week. I'm going to say cheers for now. Thanks again. I'm popping this stuff in the chat.
Thank you, Lisa. It was wonderful. Thank you, everyone. Carolina, I've copied your question as well, so we're good. Have a wonderful afternoon, everyone.
Thank you. Bye.
Bye, Dr. Moodley from Melville. I think you should move to Melville. Bye-bye.